Hi, so for my interview assignment of the biosensor, I interviewed my boyfriend's father, and I started the interview off by asking him what disease he has and what biosensor he uses because of it. Um, and he has diabetes type 2, and he uses a glucometer to check his blood sugars. And so then I asked him what were some of his first symptoms that made him think that he could have diabetes. And he said that he was really hot all the time and that he was really, really thirsty. Um, but those weren't really the reasons that he went to the doctor. He went for a completely unrelated thing. While they were there, they ran labs on him and told him that his blood sugar was in the 400s and asked him if anyone had ever talked to him about diabetes before. And so that was when he found out that he probably had diabetes, and they told him that he was pre-diabetic. He went back a couple months later, and he was officially diagnosed with diabetes type 2 and given a lot of information and resources at that time about it. And so I asked him how old he was when he found out. He is 60 now, and he was 45 when he found out that he was diagnosed. And I asked him how long he plans to need to use it, and he said that he will probably be using his biosensor for the rest of his life. And I asked him if he had any insurance problems to get it, because I know that sometimes it's hard to get things like that through insurance, and he said that he was really lucky, didn't have any problems, like having to fight them or anything for it. They provided it, the biosensor for him, and they gave him like his first pack of lancets and strips for free. And after that, he had to pay out of pocket for the other two, but he got to keep the biosensor. And another fun fact that he told me is that his talks out loud to him, and I didn't know that they had those, but that's neat. So then we discussed if there are any concerns that he had before using it. He said that it was a little nerve-wracking knowing that you have to poke yourself with a needle every day. But after he did it a few times, he got used to it, and it wasn't really an issue for him anymore. And so then I asked him how he uses it, and he said that he actually does not really follow directions when using it anymore like he was taught to and like he did at the beginning when he got it. He says that now he can feel where his blood sugar is and that he doesn't need to check it. He knows how to eat off of that, but he tries to take a baseline blood sugar every morning if he remembers. So then I asked him if there is anything he could do to kind of change his blood sugar. And he said yes, he can eat healthier, and he also has medications that he takes, and those can affect his reading that he gets on his biosensor. So I asked him about his quality of health since he's had it, and he said that it was remarkable that now he knows kind of how to change his blood sugar levels. Like, he never really heard of that before. So now he kind of knows how to eat, even though he says that he doesn't always eat like he should, that he tries to be good, and he tries to keep it in the range of where it's supposed to be. And lifestyle changes, I asked him if it was like any kind of issue, like, do you have problems taking it out in public and using it? And he said that he is more of a stay-at-home kind of guy, so it's not really an issue, I guess, to him to take it out in public. He doesn't go out a lot, he said, for meals or anything like that where he would need it to use it, he said. And so I guess he said it didn't really change it too much except for the better for his quality. And so I think those are all of the 10 questions that I asked him. He was a lot of fun to interview and talk to, and I'm glad that this assignment gave me the option to do that.